saying that hospitals in our area aren't giving them the proper protective gear that's needed to protect against COVID-19. 5 on your side's Brandon Merano broke this story earlier last week, and he has the latest from Barnes Jewish Hospital.
Yeah, and after this story aired last week, I was bombarded with emails from concerned healthcare workers. Now, those workers tell me that hospital managers hiding masks in closets and locking them away, then making employees ask for permission to use them, is just the beginning.
Management there has just lost their minds.
Big accusations from multiple healthcare workers. When did the problem start?
The problem started with the patients that were coming into the ER maybe up to 2 weeks ago, and we weren't testing anybody. Like they said that they were following protocols that were in place by the CDC, but that's not entirely true because there was patients that should have been tested that weren't.
Healthcare workers I talked to say hospital administration is to blame.
But there was doctors overruled who wanted to test, and they were told no.
Then there's the complaint of hospital staff not having the proper personal protective equipment. What do employees hear from management when they ask for those things?
That they don't have it, or they're running low on it, or it's locked up in so-and-so's office, or what have you. I have to basically beg for that.
Hospital administrators provided this answer.
When we secure N95 masks, we're trying to make sure that they're kept in a place where those people in intensive care units, caring for patients on ventilators, that are really doing high-risk procedures with people that are known or highly suspected of having COVID-19, that those masks are for those people.
WashU and BJC have also decided to test any workers in-house.
Healthcare workers who have had an exposure and developed symptoms, we can provide testing internally so we get results back rapidly.
Workers tell me their biggest concern is spreading the disease to other patients, including those who are immunocompromised.
If you talk to anybody in healthcare, that is their major worry.
Others say the healthcare industry isn't to blame because there was no way to prepare.
Why can't we blame them? They've known about this for months. This isn't nothing new. They knew this was coming. No one was prepared.
Now, those workers also tell me that some of their coworkers have been sent home for precautions and quarantine related to COVID-19. I also talked to Barnes Jewish Hospital's chief nurse. She tells me that the hospital as a system does have enough masks, but they are limiting them right now as to kind of conserve for down the road when this thing really spikes. I also reached out to the area's other biggest health employer, SSM Health. They told me much of the same, that their employee safety is their #1 priority. They said they'll continue following those CDC guidelines. Guys.